So I think while there is not a clear requirement to use antibiotics in the setting of JADA device treatment because it's in place a relatively short amount of time, one of the things that is really important with JADA placement is that you do a manual sweep of the cavity to clear anything that may be within the uterus out. And I think in that context, the fact that we're doing a manual sweep of the uterus, many of us would give a dose of antibiotics to cover that manual exploration. Because the device stays in place a relatively short amount of time, typically that single dose of antibiotics is adequate to cover the manual sweep, the device placement, and the treatment overall. So in practice, typically it's that single dose of antibiotics that patients end up getting.
When your JADA is in place and it is active, so you have vacuum working, you have a cervical seal that's filled up, fundal checks can certainly be performed during this entire process. When I am doing a verification period, or if the nurse has turned the vacuum off as well as deflated the cervical seal, I always ask that we hold the tube for that initial fundal check during the verification period. In my experience, fundal checks during the verification period where the cervical seal is not inflated can displace the JADA slightly from the lower uterine segment, and so I don't do it past that initial fundal massage.